Hello, I'm Samir Rashid. I'm Breast and Gynae Pathology Fellow at Hamad Medical Corporation, Qatar. I'm presenting this poster, cervical hemangiomas presenting as uterine polyps. It is a report of two cases that I reported with my consultant, Dr. Mohammed Akhtar. So the first case is that of a 49-year-old female who presented with vaginal bleeding and was found to have a cervical polyp. This is what the polyp looked like. This is an H&E section. The overlying epithelium is endocervical, nice and smooth. But underneath it, we see this diffuse cervical proliferation. This is definitely more than what we see in cervical polyps. This is from the second case, that is a 37-year-old female who presented for workup of primary infertility. She was found to have a polyp in her cervix that was believed to be originating in the endometrium. This is what the polyp looked like, and once again, I have very nice endocervical lining, but underneath it, I have this dense proliferation of blood vessels. At the periphery, they are more thin-lined, but in the center, they are thick-walled. A closer look at it, the very nice benign looking epithelium, and underneath I have these blood vessels. Also, there was some chronic inflammation, which is common in almost all kind of cervical specimen. So we did vascular marker. This is Cd31, highlighting the blood vessels, ERG, a nice nuclear stain for the endothelium. And now when we did the literature review for cervical hemangiomas, we found that most of the reported cases, they have estrogen or progesterone positivity in the blood vessels. So we did both these stains, and we found that in our cases, they were negative in the endothelium. I have very nice background staining, but no staining in the endothelium. This is progesterone, once again, positive in the cervical stroma, but negative in the blood vessels. This is from the second case, and similarly, I have positivity in the stroma, but negativity in the blood vessels, and a same pattern was seen in progesterone as well. Cervical polyps and cervical lesions, this is a very common specimen in any histopathology lab. Most of these, they are endocervical polyps. Rarely, they are either a tumor or coming from the endometrium as well. Cervical hemangiomas, they are rare. Mostly, they are asymptomatic. These were previously reported to be positive for hormone receptors, and it was believed that the growth is influenced by hormones. Our presented cases show that they can be negative, and even they can show growth and continued growth in the absence of hormonal stimulation. So that was it. Thank you for listening. If you have any questions, do let me know.